Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. And I'm Kerry Fink, and welcome to Helping Seniors Television. On behalf of Joe Steckler, our president and founder, and our entire Helping Seniors team, thank you for joining us. I think you're going to enjoy today's program. We're so privileged to have with us today Dr. Kevin Kilday, who is a doctor of holistic health and also operates the Holistic Health Center. You are the founder of the Faith College of Natural Healing?
Yeah, natural health.
Natural health. And so a lot of things for us to get into today as we're going to talk about holistic health. But first of all, welcome to the show.
Well, thank you for having me.
You know, Dr. Kevin, we have done along the way a number of different programs. I know that your early days, you spent a lot of time helping people through addiction recovery and things like that. And it created for you a desire to really become knowledgeable in all aspects of holistic health and how that could help somebody in those situations. And I know from there you've been able to expand the practice. You have a number of cancer therapy protocols that you use with holistic health. You've also been effective in pain management and pain relief in this area. But maybe a place for us to back up and start is, let's say somebody has heard the term holistic health, but like the average person like myself, we don't really know what it means, or maybe we've heard misinformation about what it is. So maybe could you set the stage for us and talk a little bit about when somebody uses the term holistic health, what that means?
Yeah, so holistic health is taken from the word whole, meaning a whole person. You know, actually, some companies actually still spell it WHOLISTIC, but the proper way is actually HOLISTIC, and it just means the whole person. When you're helping somebody with their with their health, like in today's traditional medicine, I call it. When you go see a medical doctor, they are trained to treat the body, and just treat the symptoms that you're having. In holistic care, we look for the root cause, and yes, we do recommend some supplements to help with to address any health issue along the same lines as a prescribed drug, but these would just be herbs. There's no prescription required, but they have a long history of being used throughout the world for 5,000 years with the Ayurvedic medicine from India and Chinese medicine, and so holistically, we look for the root cause of disease, and then and there's other elements involved too. I mean, that's just the physical, but it's also mind. In a lot of cases, if you're having a major problem like with anxiety, and depression, those could be setting off physical symptoms also. So it's good to have when you have a client to ask them, how are you feeling, mentally also. Are you having any major depression, or have you lost loved ones? Are you in a grieving time right now, or having major anxiety over this pandemic we're having? It all affects the physical, and third is the spiritual, and it's very important. I myself, I'm a Christian. I believe in my Lord and Savior Jesus Christ. But whatever your higher power is, it's good to to get close to that higher power, as part of your healing also.
It's an interesting thing, because I guess one of the things that you might posit as we're talking about this is that maybe traditional medicine is looking to treat treat a symptom. And it seems to me like, as you're describing holistic medicine, the intent anyway is to get to the, like you said, the root cause, or maybe the underlying thing. I'm thinking about a number of conditions that we talk about fairly routinely that seem to kind of like blur a line between maybe a physical condition, and some people would say, you know, okay, there's something that you should think about how you're thinking as well connected to that. And you've already hit on a couple of these. You know, depression is one, pain is one. I'm thinking of a disease like fibromyalgia, which a doctor can, you know, say, okay, I'm going to diagnose that you have fibromyalgia, but then you say, well, what's the cure for that? And there's really not a cure. It's more like a series of, well, let's try these lifestyle adjustments to see if we can make it easier for you.
Yeah, and they recommend like a maintenance, prescription, to help with the pain.
Right.
You know.
So when we talk about holistic, what do you see as the success of it when you have patients who come to you? Maybe they're coming to you for one of those specific areas that you've been successful with protocols for, whether it's addiction recovery or cancer therapy or something like that. How would you approach, or how do you approach cases differently than I guess what we're used to if we step into a doctor's office or a medical clinic?
Well, number one, I'm not a medical doctor, so I am unable to, to medically diagnose anybody. I always, ask their clients, have you been, medically diagnosed by a licensed medical doctor? And then if they say yes, and then I say I can help you. There are alternative ways to help you with your particular disease. So that's where I start. If it's, let's say cancer, for instance, there's a lot of people out there that are deathly afraid of chemotherapy. I don't blame them. I mean, it's a very difficult treatment. They're afraid of radiation. They're afraid of surgery. So, I talk with them. I have a whole protocol on my website that consists of lifestyle changes, a change in diet, the use of supplements, detoxing the body. So that's how I start approaching it, so just people have been medically diagnosed with something, and then we start taking a holistic approach and trying to find out, what the root cause of it is. I mean, if they're having stomach issues, like, if they've been diagnosed with an ulcer or some digestive issues. There are like acid reflux, and GERD is a big one today. I mean, it's not a good idea just to keep popping pills and just to reduce the acid. You got to change your diet, and you got to start eating low acid foods, and change your lifestyle, and then change the way you're thinking, possibly. Get more exercise. So it's that's how I approach it.
I was thinking as you were talking about that, I have experienced, and I'm sure you have too, relatives who have gone to a doctor's office, and I actually had remember telling a story of a doctor who told this relative, said, "Oh, the problem here is you just want me to write you one more prescription instead of trying to deal with the root of the issue." And even I was thinking about this, medical doctors, if somebody comes and says, well, there's an issue of blood pressure or something like that, I say, well, we could prescribe this medication, and or you're kind of borderline, so why don't we try, a Mediterranean diet or some other things that they may suggest as a precursor to that. So what I'm hearing, I don't mean to interrupt, but I would love to see more medical doctors that talk like that, but but they're really few and far between. Yeah, I was thinking of another case where a medical doctor had come up with a situation and a diagnosis for this person. They said, "Listen, you got two choices. We can either start you on acid reflux medication, or for that person, they said, or you could lose 20 pounds and probably accomplish the same thing. Which do you want to do?" So I'm kind of gathering, as we're having this conversation about what is holistic medicine, you're trying to approach it from the side of let's get you a little bit more in harmony with the way that things should be, and that will have a tendency to work out the problem itself.
Exactly. Yes. And like I said, I use a lot of herbs that have been in use for 5,000 years, passed down from generation to generation, and and numerous clinical studies have been done on herbs. Like I use curcumin quite a bit. Not only for pain but also in various cancers. Then curcumin is a Ayurvedic herb from India, and just a little food for thought. Like in India, for instance, it's like the second largest population in the world.
Right.
However, they have the lowest colon cancer rate in the world and the lowest Alzheimer's rate in the world.
Wow.
And they're starting to link that to their use of the spice turmeric, which they use on a daily basis in their lifestyle and their cuisine on really all their meals. And they're starting to attribute it, and curcumin is the compound in turmeric. So they're starting to attribute it to turmeric / curcumin in their diet on a daily basis. That's why these rates of these two the tough diseases are very low in that country.
I was going to ask, because a lot of times I think one of the criticisms of holistic medicine, if you talk about from the traditional medical community, is they talk about the fact that, well, we don't know if there's chemical studies. We don't know if things have been put through sort of a standardization, like, if it says on the bottle, this is what you're getting, if it's gone through an FDA process, right, supposedly this is what you're getting. And I've heard those kind of criticisms of holistic.
Yeah, they call it a double-blind clinical study.
Yeah, I was going to ask you, how do you explain from the holistic side that that's not always the case?
Well, I mean, there are many studies, even online. If you go to what's it called? PubMed, I believe, is what it's called, or the NCHI, the National Health Institute. Those websites have clinical studies, not on just drugs, but really any type of supplement or anything that you might need. Now, granted, some do lack. The double-blind clinical studies are just, something that's has been used in the United States and required by the FDA, really, for any new drug. For drugs in general, over the years, to be tested like that. But not necessarily. They don't have to be like that, like in Europe, for instance. But they are bona fide, clinical studies that are overseen by the doctors, MDs that are and PhDs that are they've been researchers all their lives, and they know how to run clinical studies. I mean, that's a whole field in itself. Running clinical studies.
Wow.
And research.
And that was another thing I was going to ask you. You've got such a background in this. You've been doing this for so many years. You've operated the Holistic Health Center here, helped lots of people just in Brevard County. We're going to talk about that in a minute. But you're also have been involved in this project called the Faith College of Natural Health. Right. And your goal there is to get other people trained in this way. Talk a little bit about the college and what somebody gains through the experience of studying with you.
Yes, this is a college that I have started with three other like-minded individuals. These are one is actually a professor at three other universities. She's also an MD. She used to practice as an MD in India, but she chose not to practice as an MD in this country. But she's a certified licensed health coach and also a professor at presently at three universities. So I'm very glad to have her on staff. Another gentleman has been has held talks and seminars, and he's also been a licensed massage therapist for over 25 years, and he sells. And he has products like like a sauna in his facility, and he sells home style saunas, and he has what do you call it? Hyperbaric chambers, and so he's just been well versed in the alternative medicine field for many years. So we're glad to have him on staff. And then another gentleman who's an herbalist that's has been developing his own blends and sells herbs. And manufactures them, and he's been doing that for many years, and he's also on staff.
So who would be a person that should take a look at the college for their own benefit?
I was just going over the personnel, but we also have at the moment we're bringing all of us to the table. About 75 different natural health courses, and some are also Bible based, also because we also offer a degree in biblical counseling and pastoral counseling. But we do offer degrees in from diplomas to certificates, from college degrees, associates, bachelors, all the way up to postgraduate, all the way up to doctorate degrees, and we accept. Transfer credits from other colleges. We're very liberal about that. As long as they have some sort of documentation, a certificate, or a letter from a professor or whatever that they take in his courses, then we would accept it as a transfer credit or credits. We're also offering degrees as a health coach, as well as certifications and holistic health, pastoral counseling. Also, functional medicine is a new one that we've just added to our courses, and we are privately accredited. Not to be confused with the public colleges accreditations, which is we're accredited by the Worldwide Commission of Religious Institutions. We're also an approved college for the Professional Wellness Alliance. And also we just have some certification too from the American Association of Christian Therapists. So we're associated, we're approved by all three of them right now.
And so how do people study with you? Is it an online based system or? Yes,
it's an online system that we're currently uploading our courses. So we're a little bit behind on our official grand opening. We're hoping to have it, an official grand opening by the first of the year. But they can contact us, and we can still, get people started on a one-to-one basis. Right now.
Well, it seems ideal if you think about it. Maybe you're a person that has a little bit of extra time on your hands and a real interest in living healthily, because as we age. I was talking to somebody who does a lot of work in assisted living facilities, and they said, Kerry, you got to understand, when you turn 55, your life expectancy is really another 45 years. So you've got, quite the way ahead. And the question is, how are you going to prepare yourself for that? Are you going to do the things that are going to help you be as healthy as you can to enjoy those years? And it just seems like if you had some time and a little bit of enthusiasm, taking courses at your college would be a great way just for your own benefit, let alone the people that you interact with.
Exactly. I mean, you can just take courses because of interest and at your leisure, or you can pursue a diploma or a certification or a college degree. And
I think, as I recall, it's very, very affordable, far more affordable than people might imagine.
Oh yes, we have. Like, for instance, our diploma modules and our certification modules, there's about, right now, about 10 of those courses, and we have them priced at $65 a credit hour. But then after that, we start going into the, they are college level, but then we just have what we call our college level courses. for you to pursue an associate's degree or something like that. And then, those start at $80 a credit hour.
And so what you're talking about is the ability to gain this knowledge for a very nominal kind of price, because if all you'd have to do is call another university and say, what does a college credit cost over at a UCF or something like that, it would be incredible.
Oh yeah, we're far below their their undergraduate and their postgraduate.
And I was also going to say, and I was also going to ask you about this, Dr. Kilday. I was going to ask you to make a comment too, because the beautiful thing about the way your courses are structured, you take these kind of on your own schedule. So as you are able to manage your schedule, you can move as fast or as just as needed.
Well, that's a yes and a no.
Okay.
If you prefer to really just pursue like a diploma, and you want to do a self-paced type of thing, yes, we can work with you, and we can grant you that. However, if you are going to pursue a college degree, we do have and this is plenty of time. We do have a 12-week limit on completing our college level courses.
Okay, so there's a great deal of flexibility built in. So
Yeah.
let me ask you this: if somebody is more interested and they want to take another step and at least learn a little bit more about the college, what's the best step for them to take?
Well, they can contact us, by phone, and that phone number would be 321-372-8963, or go to our website, which is all letters. I'm just going to say them. It's F as in Frank, C as in Charlie, N as in Nancy, H as in Harry, and then E as in Edward, D as in David, U as in Uncle.com. So that's FCNHEDU.com.
Okay, and so it's basically your natural.
Yeah, Faith College. So we just use Faith College Natural Health letters, and then EDU to signify us as being an educational. So we're not .edu, which is a little bit different. We're just FCNHEDU, then .com.
And really, anybody should take a look or give a call just to explore that further, right?
Yes.
So let's talk.
They always get a live person, on the phone. I answer most of the calls. If not, if it goes to voicemail, I always call you back the same day.
And if we're talking about the services that you offer through Holistic Health Center, that's a whole different aspect of what you do, where you sit down one-on-one with patients
Yes.
and just have a conversation about where they are, what they're trying to accomplish. And how does that work?
Well, I have a couple of specialties, or a few specialties. My number one specialty over the years have been, alternative cancer solutions. Now, I have a protocol on my website, which is holistichealthcenter.us, and the protocol is called Winning Against Cancer. And so anybody who's been diagnosed with cancer, regardless of what stage it is, and they want an alternative, natural way of treating this. I don't like to use the word treat, but a natural way of addressing it. Yes. Then they can call me, which is 321-549-0711. And then I would meet them on a one-to-one, face-to-face, and also available on Zoom too, if people are still want to, stay home more rather than venture out. I do offer that in a Zoom scenario. And but I use the 1900 building in Melbourne, right on US 1. It's 1900 South Harbor City Boulevard. I use that location quite a bit, and for the northern Brevard County clients, I use the Tapestry Community Church has an adjacent building to their church, and I use that building also up in Merritt Island. They're on Courtney Parkway.
So lots of ways to get in touch with you. Let's start with the phone number and the website again.
Yes, the website is holistichealthcenter.us. And my phone number is 321-549-0711. And, and a couple of my other specialties too. I have, many years, over a dozen years experience in the addictions field, and I'm able to help, anybody wants to get off of alcohol or any kind of drug whatsoever. I can help them get off of it naturally and as without symptoms as feasibly as possible.
And I was going to say holistichealthcenter.us. You have a tremendous amount of resources there just that are valuable to read. And I know you're always on top of the latest advances. I know we were talking about you've been involved with some air purification systems that are very effective at treating certain of these diseases, like we've all been through the COVID thing, and this is something that really helps kill off anything that might be in the air.
Yes, I had my herbalist colleague approach me, and he said, Doctor, you got to look at this product. It's an air purification product, a standalone product that we just plug it in and will sit in the corner of the room, and it has just been just this past. I think September 30th, it was announced that it went through a FDA approved lab, and it was clinically tested, and they have what they call active pure technology in this, which was actually because they work closely with NASA, and it has been used in a number of NASA programs, and they tested this thing thoroughly, and it came out to be after 7 hours in operation, it killed 99.98% of COVID viruses on all surfaces in the room.
That's amazing. So this
and you can work and live in the room at the same time.
Absolutely. So this is a reason you've got to give Dr. Kevin a call. We're out of time for today, but I hope you found this a great introduction. Thanks for tuning in to Helping Seniors TV.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.